Parks and Recreation for Prince George's County. We're a part of the Maryland National Capital Park and Planning Commission. Welcome.
And hi and welcome everybody. My name is Jessica Moyes. I am the Vice President for Community Impact with the American Heart Association, the Greater Washington region. And thank you for joining us today. Guess I can kick us off on getting everybody to either on the chat or if they want to come off mute to just give us your name, especially if you're new to this meeting, to our HEAL meeting for the month. Your name, the name of the organization. And since it's our first, we'd love to hear what you look forward to accomplishing in the new year. So again, we would love to hear your voice if you wouldn't mind, but otherwise, if you want to just add in the chat and just put this information, that'd be great. The chat so I can see as well.
I'm adding info in the chat, but I do want to share. So the other units within our division that I oversee include health and wellness. They do a lot of different, mostly free outreach programs with a focus on health and wellness, both internally. For example, we have a Rise Up program where we teach kids in our kids care programs about nutrition and fitness. We have disability services that provide support and programs for those with individuals with disabilities. Youth services, we work in collaboration with all the community centers on youth programming. And then senior services, we run 6 senior centers, soon to be 7. And all those centers serve as senior nutrition sites in partnership with the Department of Family Services, Prince George's County. And yeah, so we're looking forward to opening the new senior center at Hampton Park. It's centrally located just south of Central Avenue, just off the Beltway. And it's co-located with the county's Health and Human Services headquarters, administrative headquarters. So we're looking, they're already starting to look towards hiring and programming for that site.
Great, thank you for that, Anthony. And I'm seeing a few responses here in the chat. So Amber said to continue supporting the HEAL and Food as Medicine work groups. Really excited to have Amber joining the initiative. Tornisha said travel more often. Tornisha, any specific locations you're eyeing in the new year?
Yes, I want to go to Dubai this year. So towards the end of the year.
Nice.
Anyone else hoping to do some more traveling in the new year? Or I guess I can't call it new year. I got to call it 2025 because we are already here, already in it.
Yeah.
I'll introduce myself. My name is Tanisha Whitlock. I'm the Community Health Manager at Capital Region. I'm also a licensed social worker by trade. And this year I also want to actually go on a solo trip. So I'm looking into that. I'm thinking Hawaii. That seems very zen and serene and looks like paradise. So I'm looking forward to traveling alone, being very safe, but just more self-care this year for sure.
My name is Gwen Hector. I'm with Environmental Health, the Food Protection Program. I'm one of the supervisors. I'm going on a cruise shortly in May. However, I would like to know how we could work together with your program in the sense that most people don't know what we do. And we do more than just doing inspection for the restaurants and the schools, grocery stores, nursing homes, and stuff like that. And we want to be more aware out in the community.
Thank you for that, Miss Gwen. Well, you think about us in May when you're enjoying your cruise. You think about all the people you left behind to continue working. But yes, I will get your contact information if you wouldn't mind putting that in the chat, and I can schedule some time with you to discuss the coalition and some community engagement work.
Thank you.
And I'm seeing Michelle put graduating one of my college kids. Congratulations to them. I see relocating to Georgia, so escaping to some warmer weather, opening Hampton Park Senior Activity Center. There you go, Michelle. Anyone else? We'll continue to use that chat function, and if folks would like to put your contact information to exchange with anyone, feel free to put that in the chat and we can follow up in the meeting notes. And next for today's discussion, we have our agenda here. So we will first hear from a presenter from the American Heart Association. We have a student intern joining us today to give a Heart Health Month presentation. We'll go into some open discussion about 2025 planning, and then we will wrap up with community announcements for the afternoon.
Sounds good. So I'm going to turn it over, and I think Astrid, are you on? Just want to make sure she's on for us.
Yeah, I am here.
Awesome. Astrid is working with us with the American Heart Association rental. She is working with as our health strategies intern for this semester. And we are gonna, and obviously it is Heart Month. It is go red, all things Heart Month. And it is February. So we are going to be, Astrid is going to be doing a presentation and it is actually going to be kind of a, definitely listen, and we're also going to have some informative feedback, and there's going to be a kind of a question and answer format to the presentation. So please, there's going to be an opportunity for anybody to please to answer some questions that we're going to have. So please either come off mute, or you can, obviously put into the chat some of the responses. But I will turn it over to Astrid to go ahead and get started. And Astrid, I'll let you go ahead and take the lead, and I will go off, and I'm also here as a resource in case any other questions arise that for either Astrid or I that we could be here as a resource for the American Heart Association. So Astrid, I'll let you go ahead and take over.
Thank you, Jessica. Should I share my screen?
No, I think you're good. I think Taylor's running it, so you're good. She's gonna you just let her know whenever you need to switch slides.
Okay, perfect. So yeah, I'm Astrid. I work here at the American Heart Association as an intern. I'm going to be talking about the Life Essentials, which is a science-based sort of thing to look at. Yeah. And so one of the most important factors is this is for cardiovascular health. So 4 of them are going to be for health behaviors and 4 are going to be for health factors. This simplifies the cardiovascular health so people can better understand it and manage it. So next slide, yes. So this helps to improve the overall well-being since our mind, heart, and body are all connected. These factors also affect one another, and so this can be positive impact or a negative impact. And so it isn't just good for your heart, it's also good for your overall health and well-being. So the 4 key health factors include the blood pressure, so maintaining less than 120 over 80 millimeters per mercury, as well as maintaining blood lipids, so that's less than 130 milligrams per deciliter of non-HDL cholesterol, as well as maintaining health weight, so body mass index of less than 25, and maintaining your blood sugar. The 4 key health behaviors include not smoking or vaping, getting enough adequate sleep, so that's getting 7 to 9 hours of sleep per night, as well as a healthy diet, adhering to a DASH or Mediterranean diet, and maintaining physical activity, which is 150 minutes or more of moderate intensity aerobic activity, or 75 minutes of vigorous aerobic activity per week. So one of the things we could talk about is improving your sleep. So this is one of those interactive things Jessica was talking about. So true or false, sleeping in on weekends helps you catch up on that sleep. Right. So I see Anthony saying false and Michelle as well. Yeah, so this is false. So this doesn't actually help with maintaining exactly. So changing your sleep routine, this can lead to serious problems in the long run. You want to help maintain a consistent schedule of 7 to 8 hours of sleep on average. See, next slide. So getting enough sleep can help lower your risk of chronic diseases and type 2 diabetes, strengthen your immune system, and improve your mood and increase energy. And this can help you overall be more creative. So what can you do to get enough sleep? So one of the things you can do is getting more natural daylight exposure, and regular exercise, helping to maintain movement, so taking a walk. And so this can help easier to fall asleep, and maintaining your consistent sleep schedule and falling asleep and waking up at the same time every day. So you want to also limit your nighttime activity, heavy meals, alcohol, and nicotine, caffeine, and limiting your screen time, especially at night. So another thing is improving your diet. And so another true or false, when it comes to getting your fruits and veggies, fresh is always best. I see some truths. So this is actually false. You can actually get your diet from, which includes fresh, frozen, canned, or dried produce. You just want to avoid those that have high sugars or added sugars or sodium. So the benefits of improving your diet: a heart-healthy diet can lower your risk of heart disease and stroke. Implementing fruits, veggies, grains, omega-3 fatty acids, and lean meats can help to decrease depression. And fruits and veggies are linked to higher levels of happiness. So what can you do to improve your diet? You can add more fruits, as we talked about, plant-based proteins, as well as vegetables. And you want to limit the added sugars, the red and processed meats, as well as highly processed foods. So now we're going to talk about improving your activity. This is another factor we can look into. So true or false, to get enough activity in your day, you need to work out. Okay. Right. So this is also a false. So some people think that by running or going to the gym, that's the way that we get our exercise, but any movement counts, and this can help to boost your health, and you can even break it out throughout your day. So the benefits of moving more can help flood your brain with feel-good chemicals and improve your mood. This can boost your immune system, as well as lower your blood pressure and reduce risks of heart attack and stroke, and control your blood sugar. And this can also help to improve your sleep. So what can you do to move more? So this can include mini breaks, like stretching. As you take your breaks, you can go outside for a walk to also get fresh air, and even cleaning your house and listening to music and dancing as you clean your house and listen to music. This can also help to provide movement throughout your day. You also want to limit the amount of time that you're sitting. So at your desk, you can, again, as we talked about, stretching, getting up or walking. During your screen time, you can get up and get a glass of water. And taking the elevator, you can take the stairs and help motivate each other to move. Another thing is quitting nicotine. So true or false? Nicotine helps you relax. Right, so this is false. So in a study in Truth Initiative, they conducted a survey that saw that 90% of young individuals who quit vaping saw less stress, anxiety, and depression overall. And so nicotine actually can increase your stress levels and trap you in this cycle of addiction. So the benefits of quitting: after 1 year, your risk of heart disease goes down by half. You'll increase your chances of living longer, and your senses of smell and taste will improve, as well as your smoker's cough will go away. So what can you do to quit nicotine? So it can be difficult to quit nicotine, but some of the things you can do is to avoid emotional triggers, social triggers, or situational triggers. So if you don't know where to start, just remember that it's all connected, as we talked about, the mind, the heart, and the body. So as you get better sleep, this can lead to healthier food choices. The healthier food choices can give you more energy to move, and the physical activity then lowers your stress and makes it easier to quit nicotine. So some of the things one can do is you can take the quiz to find your focus areas, take actions such as looking at some of the pamphlets or information that we have for science backed up tips, as well as talk to a provider to get to know your number specifically and get support to your specific needs. Thank you.
Awesome. Thanks so much, Astrid. Do we have any questions or anything while Astrid's still on about the presentation? And just want to let you know we're here to help. If you guys see any information that resonates for you personally or with your organization that you want to know more about, especially around Life Essential 8, please do not hesitate to contact us. We definitely have all of these tools and resources, especially electronic resources around any of the topics that Astrid went over. I will say the Life Essential 8, we used to be called Life Simple 7. Life Simple 7 changed to Life Essential 8. We incorporated over the last year or so sleep. We found sleep that with the American Heart Association is very important. So we want to make sure that that is part of everybody's well-being. So that actually, so now it is now life. That is why now it is called Life Essential 8, because we want to make sure sleep, it is part of everybody's well-being. And it goes along. You cannot function if you do not have sleep as part of your overall well-being. So again, so let us know if you need anything or any other additional resources. And we are happy and we are here to help. And happy Heart Month.
Yes, thank you so much for preparing that, Astrid, and thank you, Jessica, for the connection. I'm curious, I want to have an open space really quick if there are any other resources in Heart Health Month that anyone would like to highlight. Anthony, I know you were sharing a little bit about yesterday what you all accomplished, but any partners on the line, do you all have anything going on this month or maybe later in the spring in terms of heart health?
Hi, good afternoon. This is Kate McGrail from Suburban Hospital. And in the PGHAC newsletter that you received, I think yesterday, there was the Women's Heart Symposium in partnership with the Health Association that's coming up this month on the 19th. So it's in 2 Wednesdays from 1 to 2 in the afternoon, featuring Dr. Hancock from the Heart Association. She was excellent. We brought her back to facilitate another conversation. This year, we're going to be talking about women's heart health, artificial intelligence, and digital health with 2 other speakers from Johns Hopkins Medicine. And I'll put the registration link in the chat.
Hey, Kate, it's Jessica. Actually, we have that as one of the, I included that as one of our announcements that you'll see it.
Oh my gosh, sorry, I jumped the gun.
No, thank you. Thank you. You it's a good tease. So yeah, don't worry. Yeah, we have that. Don't worry. I made a make sure we made a plug for our partnership. But yeah, we're gonna, but thank you for letting, and in case anybody does drop off before the end, but we made sure that we included the flyer too, as towards the end. You'll see it towards the end of the meeting as well. But thanks so much for giving that plug early on, Kate.
We'll be sure to include that in the meeting notes as well, so folks will have that physical flyer.
I wanted to give a shout out to our cook along because Jessica and her team is so fantastic and they're great partners. I'm Leslie Jefferson with Giant Food, and we are partnering with the American Heart Association for our monthly cook along. So please join us on February 13th. We'll put a QR code in the chat. There will also be a flyer at the end, but for anyone jumping off, we will be cooking with the American Heart Association, and the goal is budget-friendly meal, quick and easy, 30 minutes or less, so you can have dinner on the table. So be on the lookout for that flyer. We're happy with this to partner with the American Heart Association.
Thank you, Leslie. Any additional resources anyone would like to call out?
Hi, everyone. I don't know if this applies, but I think it might. We've got a couple of iHeart Yoga classes. I'm Devin Hardesty with Department of Parks and Recreation, Prince George's County. And for iHeart Yoga, we've got classes on Saturday mornings. These are free classes. Please come on out to Berwyn Heights Community Center if you can. Those classes take place from 9:30 to 10:30. And then we've got another iHeart Yoga, actually one tonight, starting tonight at Tucker Road Community Center from 6 to 7 p.m. So hoping that the weather agrees with us all, but those are different programs we're putting on for Heart Health Month.
Awesome. Thank you so much, Devin. That would be a great opportunity to get to release some of the stress that I am sure we are all feeling these last few weeks. So do continue to take good care of yourself and practice that self-care. Any other announcements for heart health or any other adjacent healthy eating or active living opportunities? I know we're a bit out of order today, but just wanted to call those out at this point.
So Devin's unit, the health and wellness unit, has a number of other opportunities. I know I shared them last month, but I'll send them to you to share, or a little newsletter that's distributed with other opportunities as well. For example, tonight there's another heart healthy cooking demonstration online. So it's, and then in addition, we have the free skating opportunities, Wear Red, and at either, on Saturdays at either Tucker Road Ice Rink down in Fort Washington, or at Lane Wells Linson complex here in College Park. And the newsletter will have all the details and how to register. And these are all free programs.
Got it. Thank you, Anthony. And any additional questions for Astrid?
I just want to say, Astrid, I know it was very short and concise, but it was great points. I do try to share these with my kids at home, try and turn off the TV. Of course, I'm, just as guilty sometimes. But the sleep part has so many different impacts on health, and these are conversations that I've had with my primary care physician as well.
Yeah, that's great to hear. No, yeah, I also have to talk about these things with my parents. So, yep.
Well, folks, continue to put any questions that may come up the rest of the meeting. Feel free to use the chat function, and we can bring them to Astrid's attention. But Astrid, thank you so much for joining us this morning and presenting this vital resource. Can't wait to tell the community more about Life's Essential 8. All right, and transitioning us to our next point in the agenda, as Jessica mentioned, here we are at our first meeting of 2025. And so we wanted to touch base with you all. We know we are in changing public health times. just in terms of the new year and what we are seeing federally. So we wanted to have a quick touch base with you all to see what your priorities are and what we can align with as a work group. What do we need to pay attention to in Prince George's County? How do we need to bring together our knowledge base, and what do we need to focus in on in 2025? So wanted to have this discussion with you all. We'll ask you a few questions just to gauge everyone's interest and to see how can we best make your time as part of this work group as productive as possible, and to make sure that you as an individual or as an organization are getting the best use of this work group as possible. So we will ask for your feedback through the next several questions. Our first question being, what new or emerging health challenges have we observed in our community that require our attention? These can be related to healthy eating, active living, or they can be related to other health priorities. And if anyone is familiar with any of our county documents, the RAND report, the Huron study, or Prince George's County Plan 2035, those are plans that have some health detail in there and some health priorities if folks have read those and are familiar.
I think for me, one of my biggest concerns right now is the possible dismantling of health equity based on the current administration's attack on DEI, whether health equity is going to fall the way of the equity of the DEI.
Thank you for that, Tanya. And I'm curious. I'm curious in terms of health equity and the programs that you all lead and run. What that would mean in the healthy eating, active living space. Are there recommendations that we can use from our knowledge base, or activities that we can work on as a work group that would help secure health equity and healthy eating, active living space here in Prince George's County?
That question is for the whole group, right?
Yes.
Okay.
Yeah, so just so with regard to Prince George's County, the Department of Parks and Recreation, most of our funding is based on tax assessments, real estate tax assessments, personal property taxes, and revenue from our programs. We don't get much in the way of federal funding, so that won't have a direct impact on our operations. But we do partner with PGCPS and Department of Family Services on the senior nutrition program, and then both the after school and the summer nutrition programs for our children. And so we are concerned. We're monitoring the situation, see how the changes at the federal level will impact those operations. But on the access to active living opportunities, we continue to provide a lot of free or very affordable programs for all our residents. And just our conversations with staff, we do see a heightened level of anxiety, especially within the communities within the Beltway. Both those that are here, that are immigrants, and then also with families that have family members that work for the federal government. There's just a lot of uncertainty, a lot of anxiety. We're looking at possible financial impacts. And the department is committed to continuing to provide a wide range of activities for all residents of Prince George's County. We specifically do not require any information with regard to someone's immigration status. We provide that. We just need to verify that they're Prince George's County residents, and for some programs, Montgomery County residents as well. But that's our main mission. That continues to be our main mission. That's been reiterated by our planning board chairs. So I just want to share that, that at least at the local level, we will continue to strive to provide as many opportunities as possible to all the folks that live and work in Prince George County.
Thank you, Anthony. And Tornisha, I see you're speaking, but you're still on mute.
Yes, sorry about that. So yes, here at the health department, health and wellness division, like a lot of our programs are, federal funded. Then we do have a few that's not federal funded. So, and it's just based on funds from the state or from the county. And so we will continue to offer those programs, even the federal programs that we have. We're just looking to see how we're going to message it, but our goal is still to serve those target populations, but we're just trying to be creative in the messaging and just how to see will we continue to be funded, because our current program that we have is really focusing on the African American population, the Latinos, because it is mostly effective and have the high rates of prediabetes and diabetes. So right now our communication with CDC has been on pause because of all the executive orders. So we're just curious to see what's going to happen with our funding from year 3 to year 5. But again, we still offer the DPP program, and we did move from free to billable because insurance and Medicaid and Medicare cover the services. So that's one way we can continue, but we just won't stay focused on certain target populations. Just have to be mainly open up to the community, but we will continue to do our marketing, and when we do our market, working with Channel 9 and, WHUR actually focus in those target areas. So we're just trying to see how our communication would move forward and what does that look like.
Thank you for that, Tornisha. And David, I see your hand.
Hi. So my name is David. I'm a policy analyst for the county council, and this isn't a challenge yet, but it's a challenge that I am anticipating happening. So I don't know how many of you all, I mean, I'm assuming many of you, because of the healthy eating, active living group, but what's called the community eligibility provision, which allows schools where a certain percentage of households attending that school if a certain percentage of those kids attending that school have come from households where that are receiving means tested benefits programs, so SNAP, WIC, etc., then if it's over that percentage, all of the kids at that school receive free school meals. That is one of the programs that has been specifically targeted by Project 2025. And so I am anticipating that is one of the next shoes to drop, such as it were. And some folks at the Maryland Free School Meals for All, which is a a coalition that's run by Maryland Hunger Solutions, have run the numbers, and Prince George's County would be the school system that would be hit the hardest of all Maryland school districts by the removal of that program or significantly restricting that program. So something to keep in mind. I can share out to whomever that work group the contact information for the Maryland Healthy Free School Meals for All work group, in case folks are interested in joining and want to kind of look into that some. And they do a lot of more state-based stuff, talking about different legislation at the state level. But I don't know if there is any. There hasn't been much movement yet at the county level, just in anticipation for this yet, but we will see. And so I just wanted to kind of mention that. Thanks.
Thanks, David. And as we're thinking about, our efforts as a work group, we will continue to be as transparent as possible as we find out information and as we find out these resources, like that one that David just mentioned with the work group. We will be sure to share out these opportunities for you all to engage with and advocate for with your organization and your expertise here in Prince George's County. And Leslie, I saw your hand earlier.
Yeah, I just wanted to make a comment, just in general about the innovation and adapting our focus, and just in general in partnership. I know that there's a lot of changes that may or may not occur. There are some organizations that will be affected and impacted differently than others. So from a corporate perspective, we still have the same at Giant, we have the same drive to serve the community. So, looking at the different resources that may be impacted, partnering with organizations that aren't as impacted as much, maybe trying to build some innovation around partnership. That was my comment.
I appreciate that, Leslie. And yes, however we can continue to facilitate those conversations, do let us know. We want this work group to be a very open environment where folks can express your needs and updates to your organization. So please do keep us updated as things happen. If we can help facilitate any partnerships with members who you see on the call today, or get you any helpful information. And Tonisha, I saw you come off mute.
No, I was just agreeing with Leslie, and actually we'll be reaching out to her to follow up on some meetings we started earlier in the year since we brought our nurse on board. So definitely, strengthening partnerships and coming up with innovative ways how we can still serve the community.
Absolutely. Any additional ideas or feedback for any priority areas here in 2025? Anything else you want to put on the HEAL work group's radar? Anthony?
Yeah, and you had a presentation I think it was last month on mental health, and I thought that was great. I think that will continue to be a large need or an area of concern within Prince George's County. And so, again, any collaborations we can do, sharing information with regard to resources, training for staff. So, for example, today, unfortunately, I had to back out because my life is not my own. I was scheduled to attend a mental health first aid for youth training program. And so a lot of our folks in our kids care program, as well as disability services, did attend. And it's a really a wonderful program. It's very rigorous. It's a day long, but they need your attention all day long. And a free program. But it's again, lots of great information and resources that's available. And we are more than happy to sponsor any of those types of trainings at our facilities. We are in just about every community within Prince George's County. So, anytime that somebody's looking to do those type of presentations, we're open to partnering and providing that opportunity.
Thank you, Anthony. And Anthony alluded to one of our other work groups, our Behavioral Health Advisory Group. They also meet on a monthly cadence, and we also have our Health Equity Work Group. So if those work groups are of any interest, or if you would like to join and hear updates, please do feel free to join us. I will put that information in our meeting notes, and I can certainly forward any meeting invites to those who are interested and would like to come. Those are open meeting invites, so anyone from the community can come, any of our community partners, any community members, community-based organizations. Do feel free to join those calls as well. Any other comments or feedback for the questions that we have up on this slide? All right.
All right, so here I will take the lead on this one. So the next set of questions is around just expanding our reach as a HEAL committee. So the first area that we really want to look at is how can we engage more volunteer partners or community members in our efforts for this year. We're always trying to engage more members into our committee. So what can we feel that we can do as a HEAL committee, as a HEAL subcommittee, to engage additional volunteers or partners and organizations into more of our efforts as we try to expand our reach for this year?
And it's helpful if folks want to take a look in the chat or just take a look around and see the boxes that are surrounding you on today's Teams call. Who is missing from our circle? Who needs to be at the table as we have this discussion? We just talked about, our strategies of how we need to come together during these times and share our information and our resources. So I'll just ask, is there anyone who is missing, or any opinions we need to make sure that we are including in our bi-monthly discussions?
Like, I feel right now, just, and again, and I think we used to have like a stronger presence. I feel like university presence, for example, like maybe University of Maryland, or even local Prince George's Community College. So maybe like having more of that. I remember we used to have more of a presence there. I can't speak on on our other two subcommittees, but like I know that on our HEAL committee, I think that was important for us to talk about that, especially when we're looking at nutrition and security and things of that nature. I think that was important when we're looking at campus and just surrounding communities, but Bowie State. So if we're looking at Prince George's County, those I feel like, those are, I feel like we need to re-engage with those as far as our university members. Anybody else that like, and I know there's probably numerous ones, but those are some ones I can think of just like right off the bat that I feel like are missing, that were once in the fold.
So,
Oh, go
so
ahead,
this
Anthony.
is,
Get back.
I was going to say, so I'm going to mention something. This isn't directly associated with the HEAL work group, but the Department of Parks and Recreation, and this has been several years in the making, has recently taken over permitting of the athletic facilities for Prince George's County Public Schools. And so one of the things we're looking to do is to expand opportunities for leagues and local boys and girls clubs and other athletic groups to have access to facilities. It's always been somewhat of a challenge, and we're just trying to make it a smoother, easier process. There will continue to be some capacity issues, but I think going forward into the new year, that we will have a better handle on permitting for the general public in Prince George's County. So, yeah, so it's, that may not be specific to us, but on the larger, health, active living type of focus, it does provide additional opportunities, especially for youth. And that's the vast majority of the permittees are youth.
Thanks, Anthony. We will certainly reach out to engage with your staff members to hear more about that.
One thing that came up actually earlier today. So this morning I was part of the stakeholders meeting with the YMCA. So the YMCA right now, they're in their current strategic planning phase for 2025 to 2028. They're engaging with certain members. I was asked to be convened as far as like what their vision is for the next 3 years and what the YMCA wants to be known for in the community for the metropolitan region. As we know, the YMCA is in Prince George's County. And what are some of the holes that they can fill? And as we know, they do play a role in food insecurity. They are a partner in nutrition, SNAP, and things like that. So I feel like they could play more of a role in Prince George's County. I think they're a huge they do a lot of things that we work with them in DC, but I feel like they could play a larger role in Prince George's County. So I feel like bringing them in their fold and figuring out what they can do and how they can benefit the community in Prince George's County might be good, especially as they're trying to put together what their vision is and what we need, what the holes and gaps they're going to fill in the community for the next 3 years. I think this might be a good time to re-engage with them. I think at one point they were part of this coalition. I've like I said, they're longtime partners with the American Heart Association, so I could definitely reach out to Christy, who is a VP of Community Health over there, to figure out who the correct person would be to take the lead. And but yeah, I felt like we should re-engage with them. That you reminded me of that, Anthony, when you mentioned like the Boys and Girls Club as well. But I think like when we're looking at the landscape, when we're looking at the new political landscape, I feel like community-based organizations are going to be those safety net organizations. They're the ones that are going to fill like those gaps, whether they're vaccine clinics, whether they're going to be those nutrition gaps that we're going to need for, unfortunately, that may be that nutrition security gap for kids after school programs and things like that. And I feel like this is the time to like figure out what that's going to look like and kind of get ahead of the curve. So I feel like that might be missing a little. We can kind of reconvene and bring some more of those organizations in this.
And this will be an iterative conversation that we have multiple times throughout the year.
Absolutely.
So as you are leaving today's meeting, if you're looking through some of the listservs that you're a part of and you have any ideas for members who we should reach out to, please do feel free to send that to our PGHAC email and I can get them coordinated with our meeting invite. I'm going to move us to our next question here. Asking about how we can enhance the experience of those who are already a part of the work group. So everyone today here on the call, we want to make sure again that this space is a worthwhile experience for you all, that you can come and you can share your information, share community events as you have done today. But are there any improvements that we can make to ensure our volunteers have a more rewarding and impactful experience?
Hi, Taylor, this is Michelle. I think one of the first things that comes to mind for me is that there are quite a few people here that represent just a vast array of services throughout the county. And I know that you have the listserv on the email, but and maybe this exists someplace, but perhaps a list of the members and their organizations, and the work that they do, some type of, contact list, because I see a couple people here that I've already copied and pasted their contact information. I'm going to reach out to them after the call.
So if there was a one-stop place for that, that would be super helpful. I think that would make it a lot easier for us to connect.
Absolutely. Any additional ideas for how we can continue to keep folks engaged?
So, I do get the county executives newsletter, the county council, some of the county council member newsletters. I don't know how much access we would have to share information via those e-news blasts, but I think that would be a great opportunity as well. I know sometimes there's a lot of information on those emails, but it's still, if you're willing to dig a little bit, it's great. It does provide some great information on various initiatives within the county.
For that, Anthony, yes, we can take a look and see what information we'll be able to share. So using Michelle's feedback, we will strengthen our contact list, be able to share that out with you all, and then be able to get out pertinent information updates as they come out. All right. Any other points for how we can empower and engage our volunteers who are active in the HEAL work group? All right. Well, again, as ideas come up and as we go through the year, please do let us know. We want to make sure that folks feel engaged. We know that these are isolating times, very polarized times. So please do reach out to see how we can best support your organization or you as an individual. We want to make sure that we are centering community voice, community priorities. So this is certainly not the end of today's discussion. We will continue to have these discussions about shifting priorities and responding to the immediate needs. But of course, as things come up, please do keep us updated and informed. I'm going to go ahead and move us into our community announcements. I know there were several that were shared in the chat already, but I will go ahead and give Jessica and Kate. Here is that flyer that you all were mentioning earlier.
Yeah, thanks, Taylor. So yeah, again, so Kate already did a great job of kind of giving a recap, but this is an upcoming webinar. We hope everyone is available. We will send it out at the end of this with the notes, but yes, this is coming up February 19th at Artificial Intelligence and Your Heart for AI discussion, how artificial intelligence and digital health are revolutionizing women's heart health. Obviously, this is very timely discussion. And hopefully everybody who is available can join. Obviously, it's completely free. Partnership between Johns Hopkins and the American Heart Association and our Go Red for Women campaign. And it's 1 hour at 1 p.m. on February 19th. So we're hoping everyone can log in and take part in it. So yeah. We'll send out the details to register prior to the 19th. We'll send out the flyer for that. And Leslie, I see you're still on. I'll let you go ahead. Oh, sorry. Yeah, no, this is another one. I'm sorry, Leslie. We have a cooking one too. I'm sorry. I'm like, Leslie, we have one and then we have one that we're doing. So this is another one. So our Baltimore market, so I know, but Berkshire County's not that far from Baltimore. We have an opportunity. If you are interested, there is a Train the Trainer program that we are offering with the American Heart Association in our Baltimore market that they are accepting applications now through February the 28th. Classes begin in March, where you have an opportunity to sign up and it is a free 1-day class. They will provide an in-depth culinary skills class. And the great thing about it's not just a class, but you will also have an opportunity to have a mobile kitchen kit. that will be provided to you. So the classes are open to healthcare professionals, community leaders and educators, and faith-based organizations. So classes are limited, space is limited. I believe it's, gosh, I think I want to say it's a total of 12 organizations, if I'm not mistaken, that are going to be selected for this. So if you are interested, please, please, please go ahead and try to register and fill out the application as soon as possible. And you will get a certificate of completion. And again, the big thing is you actually will get an actual mobile kitchen kit will be provided to you for signing up and participating in this Train the Trainer program. Again, it is in Baltimore, but it's not too far. It's only about 30, it's only like 30 minutes away from Laurel. So it's not too far into the weeds in Baltimore. So hopefully if you are interested or you know somebody who is who would benefit for this an organization, please feel free to send this out to them as well and just encourage them to register and to fill out the application as soon as possible. So now I believe it's going to be the giant cooking webinar. There we go. Go ahead, Leslie.
Yes. So we're going to be cooking. This is in your kitchen. This is Cook Along with Us at Giant. We have the nutritionist team on the call, and we will have our friends from the American Heart Association on the call. We will be making some wonderful dishes, some salmon, and involve salmon cakes, and it involve different ways with cauliflower and other greens. So you get to try something new, try some new flavors. It's free. You come on, you're at home in your kitchen, it's virtual, and you can swap things in and out. We talk about a variety of things. The American Heart Association is going to share wonderful tips for your heart. And we just encourage you to share this with your community and your membership because we have a lot of fun. Our cook-alongs are monthly, but this is a very special one that we're having just for Heart Health Month. So we encourage you to visit giantfood.com, register for a class, and join us and cook, because the goal is to, by the time you're done, you could put dinner on the table. So it's not just to learn. You sit down and you eat with your family and you have dinner done. So hopefully you can join us. Here we go. So here is the just the full schedule of the cook-alongs for the next couple of months. So we have our partners with the American Heart Association in February. In March, we're doing Taste of Community. We'll be partnering with the Culinary Institute in the area. And in April, we're going to be doing a sustainability session with the Boys and Girls Club. They have a wonderful summit that comes to DC in June. And to start off their summit and leading up to the summit, they have different programming with Boys and Girls Clubs throughout the country and particularly in our region. So they're going to be joining us to cook with us. So some of the kids from the Boys and Girls Clubs locally will be cooking with us and learning more about sustainability and food waste. So very interesting interaction in April and March as well.
Thank you, Leslie.
Mm-hmm.
And next, want to highlight Prince George's County Parks and Recreation. Anthony put a link in the chat. There are so many events coming up. Devin had also highlighted some of those yoga. So opportunities, many healthy eating, active living activities going on through the month and throughout the year, really. So feel free to take a look at that link that Anthony put in the chat. I will make sure to include it in the meeting notes, but many opportunities to get engaged in the community. It is also Black History Month. And so we wanted to highlight again, Prince George's County Parks and Recreation Department is having many great opportunities to highlight Black excellence and Black History Month. And so coming up on February 22nd is Headshots for Success. So folks can head out and get a free headshot taken, a free professional headshot taken. And there's also on coming up is the Family Trivia Night, which is Black History Month themed for folks interested. And there are so many additional events. I think there's an event happening every day throughout the month of February. So feel free to engage in those activities, and that calendar can be accessed through that link that Anthony shared in the chat. Next, we want to highlight our friends over at Vibrant Health and Wellness Foundation is hosting a partnership for a healthier Prince George's County conference, hoping to get some folks in the room, start to talk about how we can empower community members to advocate for their health priorities and for social equity. So this conference is taking place on Saturday, April 5th from 9 a.m. to 3 p.m. at the Prince George's County Community College, and I can share out this flyer in the meeting notes for folks who are interested in attending the conference. Lastly, Michelle, to Michelle's point earlier, I think Michelle might have a crystal ball on me because she predicted what we are trying to do next. We are trying to put together a better partner list with all of our active members, their affiliations, the organizations, the services provided, and any challenges that they may have right now working in the community. So we are hoping that folks can take the survey by next Friday, February 14th, capture this information, and we will be able to build out a more updated partner database to again start identifying those gap areas and be able to return this resource to you all as you think about your organization's partnerships and collaboration opportunities. So with that being said, I will just give open space if there are any additional opportunities that folks would like to share, or any other community announcements. All right. And Tanisha, yes, I can certainly, I'll email you that. And then I'll also be sure to include the information about the professional headshots in the meeting notes. But otherwise, I will take all of the links that folks have shared here in the chat and make sure I'm getting these out to folks. But we will reconvene next on Wednesday, April 2nd at 12 p.m. But let us know if you need anything in the meantime. Continue to take good care of yourselves. And thank you so much for being a part of this change and all of the commitments that we have here in Prince George's County as it relates to health and social equity. We appreciate you all.
Thank you.
Thank you.
Taylor.
Thank you.
Hi, everyone.
Thank you. Bye.